All right, hi, good afternoon, everyone. Thank you so much for joining our Using Psyches for Health Disparities webinar hosted by the Office of Population Health and Evaluation. So before we get started with today's training content, let's briefly go over some housekeeping details we have. So we will be using the Q&A box features via WebEx, so all phone lines are muted for today's training. If you click on the three little horizontal dots at the bottom right of your WebEx screen, you can type in your questions in the Q&A box, and it will be submitted to all panelists by default. Please do not use the chat function as it will not be monitored, and we will leave time at the end to address some questions on air, and we will also have the slides and recording posted to our public website after the webinar as well, and we will be emailing it to the attendees as well. All right, so let's get started with today's training. Here we have a list of topics that we will be discussing in this webinar. So first we will do a Psyches overview, which might be a review for some of you. We will talk about what Psyches is, who's included in the application, what type of data is available, and then we'll toggle over to Recipient Search, and we will take a look at certain health disparity filters we have in Recipient Search to complete those group cohort searches of interest. We will also review client level details within the clinical summary and show where to locate some disparity related information there. And then we'll touch on MAQI report, which is where we'll show the health disparity related quality indicators that we have. And we'll also show you the race and ethnicity view we have in our QI reports as well. And then we'll take a look at statewide reports, and then we'll touch on vital signs dashboard. And at the end, we do want to get your feedback as our users to see what enhancements we could make to the application that would be helpful for the work that you do. And finally, I will also go over some of our training and technical support information. All right, so let's begin with Psyche's overview. So, what is PSYCKES? PSYCKES stands for the Psychiatric Clinical Knowledge Enhancement System. It is a secure and HIPAA compliant online application for sharing Medicaid claims and encounter data, as well as data from other state administrative databases. So, what we do is we put all of this information in a user friendly format, and it's designed to support data-driven clinical decision making on an individual level, as well as quality improvement and population health management on that provider population health or that provider population trend level. So, for example, you can utilize the data collected in here to make plans for an individual client or have interventions scheduled at a provider level. So, with the constant flow of data in Psyches, we do have this ongoing data updates where the clinical summary is updated on a weekly basis, whereas our quality indicator reports are updated on a monthly basis. So now that we know what Psyches is, who am I going to be able to view in the application? We do currently have over 13 million individuals viewable in Psyches. It includes individuals with any history of Medicaid-funded behavioral health diagnoses or treatment, or any state psychiatric center inpatient or outpatient services, or health home outreach or enrollment. So if a recipient falls within this population, we will have the data included in Psyches. So some examples of information that you can find in Psyches include data regarding general medical health, behavioral health, lab and pathology, inpatient or ER information, crisis services information, and many other types. So we have a few different data sources feeding into our application. So our clinical summary provides 5 years worth of data, and again, it's updated on a weekly basis. So our biggest data source that we have is Medicaid billing. So all the Medicaid fee-for-service claims and managed care encounter data is coming into our application across treatment settings. I do want to mention that with the Medicaid billing data source, there is a bit of a lag from the time the service occurs to the time it shows up in the application. So, for example, something like medications, we consider those a little bit quicker with a quick timer turnaround time from the time the medication's picked up to the time it shows in psyches, and it could be as short as 2 weeks. But things like outpatient and inpatient services, it can take a couple of months from the time the service occurred to when it shows in our application. But that's why we have our other data source set. So it is our state administrative databases as listed on the screen, and those are more real time with a 0 to 7 day lag here. And I will mention a few here. So we have New York City Correctional Health Services. So if somebody spent some time in jail-based setting, we will have that data in our application. We also have Department of Homeless Services data for New York City, health home enrollment and CMA provider information from MAP, and we have the name and the contact information for the health home as well in our application. So if somebody spends some time in a state PC, we have state PC EMR data feeding into psyches. We have AOT Act information, residential and adult housing program information coming in from CARES. And then we have suicide attempt information. And the data for this comes from NIMERS, and it includes all available data. So even if a suicide attempt occurred 15 to 20 years ago, that would still show up in our application. And then we actually also have safety plans, screenings, and assessments that can be entered in by you as the provider into the application through Psyche's My Choice. And then lastly, we have intensive mobile treatment, AOT referral under investigation, and our newest source of data, mobile crisis team information coming in from DOH, MH, Maven. So in the past couple of slides, I mentioned quality indicators multiple times. So what exactly are these quality indicators, also known as quality flags? The Office of Mental Health has identified a number of health conditions or treatment issues that are quite important. And what Psyches does is that it tracks individuals who are positive for one or more of these health conditions or treatment issues. This way, the provider, the network, the managed care plan, local county, even the state government leadership can be made aware and take necessary interventions to help assist those individuals. The other thing we do regarding quality indicator is we roll up the information as aggregate data in order to provide prevalence rates at the program level, at the agency level, at the network level, etc. So you can look at the prevalence rates and see where there are opportunities for improvement. We have a number of different indicators that are sort of broken down into indicator sets or buckets. And for today's training, we've detailed a couple of quality flags that might be related to health disparities in the work that you do. So our first example is the Vital Signs Dashboard Child Indicator Set. And an example that we pulled for this indicator would be no well care visit past year. And then we have the Vital Signs Dashboard for adults. And this indicator would include measures such as no follow-up after mental health inpatient within 7 days. If you have any questions about why somebody is showing positive for a quality indicator, you can always go to our website and our quality indicator page and look up the technical specifications. But if you have any further questions, you can definitely email our help desk, and I'll make sure to provide that contact information at the end of the webinar. Another thing that I wanted to mention is this performance tracking indicators, and these are unique indicator sets in Psyches because DOH calculates them on mature Medicaid data. So what that means is that DOH calculates the indicator sets after a 6+ month billing data maturation period to allow for service invoicing. So the as of date that you see in the application, these reflect the most recent performance tracking data run by DOH, and these measures are based on a 12-month period of services. So all of this data that we previously discussed is available in different types of reports and psyches. We have the individual client level reports, and that, of course, is our clinical summary, and that's Medicaid and state databases treatment history, and that provides up to 5 years worth of data. We also have the provider level reports, and there are four different types of provider level reports. We have the MyQI report, and that will display current performance on all quality indicators. So within these QI reports, you can review the name of the clients who are flagged. If you are a provider level user, you would enable access to get information for that specific recipient. Similarly, for recipient search, you can run ad hoc reports to identify cohorts of interest. You can also look at a list of recipients in different advanced views, which will show you different information that you may be interested in. If you have provider level access, this is where access would need to be enabled to get access to the clinical summary information from there. Next, we have our usage reports. So usage reports are helpful as they are used to monitor PHI access by staff. So you can go into usage reports and see who is viewing clinical summaries for specific recipients. You can also see who is enabling access and by which type. So if access was enabled by a provider user by emergency attestation, or if a client consent was entered, that is something that you can view in the usage reports. Then we have the utilization reports, and this is to support providers that have value-based payment data needs. Lastly, we have our statewide reports, and these are very similar to my QI report. So through statewide reports, you can look up a quality indicator and review statewide proportions by provider location, region and county, client residence, region and county, plan, network, and provider. And these are at the aggregate level as well. All right, so now let's jump right into our recipient search in the PSYCKES application. So the recipient search is a tool for population health management and oversight. And here you can build your own cohort searches, searching by particular demographics. So clients are linked to a provider agency if billed for in the pasture or currently linked through MAP. And you can search using these different criteria such as race or ethnicity, county or region, social determinants of health domains or conditions, individuals experiencing homelessness, complex needs, high utilizers, and many more. And the thing about a recipient search is that whenever you complete a search, you always have the option to export this information in an Excel format or a PDF format. And along with our recipient search standard view, we also have these advanced views where it's going to display additional columns with some of the information that you may be interested in. So some examples of our advanced views are care coordination, complex needs, health home plus, high fidelity wraparound, high need, high risk population, hospital utilization, and outpatient providers. So this is what our recipient search in the PSYCKES application looks like. So as you can see, this screen is divided into two tabs. So we have our individual search and then we have our cohort search. So the first one that we're going to focus on is individual search. Here you can directly type in the client's Medicaid ID and complete an individual search. If you do not have these recipient identifiers, you can also search for a client using first name, last name, and date of birth combination. So when we toggle over to our cohort search, this is where you're going to see all of our different filters that you can apply to get the information that you need. One thing that I did wanted to mention is this limit number of results option located at the top corner. So by default, this is set to 50. So whenever you run a recipient search, by default, it's only going to show you 50 recipients. Whereas if you select this drop down, you do have the option to expand the number of results that it shows. So here we have filters divided into sections. So we have characteristics that includes age range, race, ethnicity, as well as client region and county. And then we have a section for population and planning considerations. So we have all these different filter drop downs that you can select from, which we will go over in detail in the next few slides. And then we also have the social determinants of health section, as well as managed care plan and Medicaid. And you can scroll further down and you will also find all these additional filters that we have available. So let's go and discuss the social determinants of health section. So this section includes societal and environmental conditions that can impact a wide range of health risk and outcomes. So here we have our social determinants of health conditions, and it will show you all these different categories. And when you select this small gray box right here, you can actually expand this domain or category, and it will show you these subcategories. So in this example, I have selected a social determinants of health condition, as well as these subcategories such as unsheltered homelessness, extreme poverty, and food insecurity. And for this filter, you can actually select up to 4 different SDOH filters at a time. Another thing that I wanted to mention is this look back period. So by default, this is set to past 1 year, but when you select this drop down, you do have the option to change it to past 2 years or past 3 years. So this is what our social determinants of health filter looks like in our PSYCKES application. And then let's go to our characteristics section. So here we have this race filter where you can select up to 4 race at a time. And this is a checkbox where multiple selections can be made. So you can select 4 at a time. And this uses this OR logic. And then moving right down to our ethnicity filter, in conjunction with the race filter, you can also apply this ethnicity filter, and it's going to use this AND logic. So the drop-down options that we have available is Hispanic or Latinx, not Hispanic or Latinx, and unknown ethnicity. Again, you can use these 2 filters at the same time, and it's going to use this AND logic where it's going to show recipients who fit the criteria for race and the ethnicity that you selected from this dropdown. So let's discuss the client region and client county filters that we have available. So the region filter is based on the county of fiscal responsibility, which refers to the county where clients are registered to be receiving Medicaid funds. So when you select this drop down, you have Central New York, Hudson River, Long Island, New York City, and Western New York. So these are the options that you can select from and narrow down your search results. Right underneath it, we have our client county filters. So whenever you have this client region selected, it's only going to show you counties within that region. So for example, we have Hudson River selected for client region in this example, and then it's going to show all the counties within that region. So you can, of course, use both of these filters at the same time, and again, it's going to use that AND logic. Another filter that might be helpful for the work that you do is this high mental health need filter, and that is located in our populations and planning considerations section. So if you go to the very first option drop down that we have, population, you can search by different population, including our high mental health need filter. So you can apply this filter, and it's going to show you results associated with high mental health need population. So going just one step down, within this high need population filter dropdown, we have high Medicaid inpatient ER cost filters, and we have them for top 1% and top 5%. So these identify behavioral health Medicaid enrollees who represent the highest cost statewide for any inpatient or ER services. And these are linked to the organization under which you log in as. So this will bring up clients that you are serving that are identified as highest cost statewide. Now, this filter is updated on a monthly basis, and it includes cost associated with inpatient or ER services for any cause, including medical, psychiatric, or substance use services. So making just going down through the list, we have this homelessness alerts filter, and here it has the same logic as the race filter dropdown, where it has these check boxes and you can make multiple selections. So you can search for somebody who's had shelter according to DHS, or outreach according to DHS, behavioral health shelter past year, DHS, or they've been unsheltered past 1 year according to Medicaid. And again, if you search using the DHS information, this will include that shelter name, the program type, placement date, and exit reason. And then it will also include shelter director contact information. And all of that is going to be included in the client's clinical summary. So you'll be able to view all of those important information when you drill into the client's clinical summary. And again, you can select 4 alerts per search. All right, so we are going to discuss these complex needs filter. So we have another multi-select feature option. So at the top, you can search for individuals who meet any of the complex needs criteria, or you can go below and select general eligibility criteria or additional eligibility criteria for children and adolescents. So you can multi-select up to 4 different complex need filters here. And now we come down to our quality flags filter. And here you can search for disparity related quality flags or any of the adult or child vital signs dashboard measures. And you can select up to 4 quality flags per search, and it's going to use the OR logic. So some of the quality flags that you might be interested in could be no follow-up after mental health ED visit 7 days, or no follow-up after mental health inpatient 7 days. So these are some of the filters that we have. And if you'd like more information, for example, if you are looking for a definition of any of these particular quality flags, we have this definitions link located right next to the title. And when you select this link, it's actually going to pull up these definitions. So it's going to show the display name, the abbreviations, as well as definition. And you can also export these definitions in a PDF format. So you can download it and save it to your local file as well. That's another option that we have available. So now that we discussed some of the filters that we have that you could use in PSYCKES, let's actually run the search result and see what it looks like. So in this instance, we have a couple of different filters selected. So we have race, and as mentioned before, when you multi-select here, it's going to use this OR logic. So we have Asian or Black or white. And then because homelessness, alerts, ethnicity, provider, and SDOH condition, these are coming in from different sections, it's going to use this and logic. So our search result is going to include race and homelessness alerts, so any past 1 year DHS Medicaid, and ethnicity. Here in this example, we have selected Hispanic or Latinx. For provider specific, for providers, we have Main Street Mental Health Clinic, and for SDOH condition, we have problems related to housing and economic circumstances. So when you run this result, it's going to, in this example, it's saying that there are 442 recipients found, and this is the table that's going to be displayed. So here we have name of the client, their gender and age, their Medicaid ID, their date of birth, race and ethnicity, Medicaid managed care plan, the quality flags. This column is what we call our planning consideration column, and then this current PHI access column. Right now, we have the information de-identified, but in your instance, you will be able to view the client's name. One thing that I did wanted to mention is that in this example, we do not have the client's consent present. So that's why you are seeing this enable access option. When you do have client's consent, and you can go to enable access, enter the consent. And once you do that, their name is actually going to show up in a blue hyperlink, and you can click on that and it will take you to the clinical summary. Another thing that I wanted to mention is that what we have here, all these columns, we call this our standard view. When you go to this option located on the top right corner, you have these different views that you can select from. So when you click on this little eye icon next to view, it's going to show you this information where on the left side of the column, we have all these different advanced views, and then all these additional columns that are associated with that specific view. So for our standard view, we have quality flags and planning considerations, whereas if you want to look at care coordination information or high need, high risk population information, all these different columns are going to be displayed when you select those advanced views. So that is an example of the recipient search and how you can apply different filters to get the information that you are looking for, as well as changing the views and psyches to display additional information that you may be interested in. So let's jump into the clinical summary. So once you drill into the client's name, what are the information that you are going to see? So our clinical summary in Psyches, it summarizes up to 5 years of treatment history for a client, and it sort of creates an integrated view from all databases available through Psyches. So we have data coming in from hospitalization, from Medicaid billing, state PC residential services from state PC EMR, health home information from MAP, suicide risk from NIMERS, AOT court orders from OMH database, homelessness information from DHS and Medicaid, mobile crisis from DOH, MH, Maven. And it basically summarizes all these information coming in from different databases to support rapid review. And in the clinical summary, you can actually drill into these episodes of care based on the date of services if needed as well. And our clinical summary is organized by sections like an EMR. So all of this information that's being pulled in from all these databases, it shows in a very digestible chunk, so it's easier to follow through with the information that you're looking for. So, what are some of the clinical summary sections that we have? So, when you drill into the clinical summary, you'll see a section called General, Care Coordination, Notification, Active Medicaid Restrictions, Alerts, Social Determinants of Health, Quality Flags, Care Coordination, Medication, Crisis Services, Hospital ER section, Dental and Vision, laboratory and pathology, radiology, and transportation. So we have all these different sections with information added in them. So here's a view of our clinical summary. So as you can see, we have these two different toggles option available. So we have the brief overview, which is a one-pager document that highlights the most important information so that you can access the information that you're looking for rapidly. Another thing that I wanted to mention is that for our clinical summary, you can also export this in a PDF format as well. And as you can see, we have the general section, so it includes information such as date of birth, address, Medicaid ID, and all these other information. We have current care coordination section, notification sections, alerts, and as you scroll further down, it's going to include more sections, and I will show that to you shortly. One important thing that I do wanted to mention is this data sources link that we have at the top of the clinical summary. So because we have so much information coming in from multiple databases, what this document does is that it shows you the different databases where the information is coming from. So for example, for New York State Medicaid billing database, it will tell you for consumers who have received behavioral health diagnosis services or psychotropic medication paid for by Medicaid. And in this column, it actually shows you the information that is being pulled from this database into Psyches. And it also tells you how frequently that information is updated. So for Medicaid billing database, we have all these sections being pulled into the clinical summary, and that information is updated on a weekly basis. So you can also export this in a PDF format, and you can download it and save it for future reference as well. So we are still in our brief summary. So as you can see, we have a section for alerts, and that is all available data. We have social determinants of health. We have active quality flags, and it also shows you this as of date. And then we have our diagnoses past year. And as we scroll further down, we of course have our medication information right here. We have outpatient provider information as well as all hospital and crisis utilization information. And at the bottom, you can see the as of date. So that was our brief summary. Let's dive into our full summary. So as you can see, you can export this information in PDF and Excel format. You also have the option to show data with special protection, or you do also have the option to hide that. So here we have our general section, so name, date of birth, address, Medicaid ID, and all the relevant information. We have our care coordination information. So in this example, we have health home. So you're going to find the name of the health home provider, the main contact referral, as well as the phone number, as well as the contact email. And then as we go down to our notification section, we have these notifications such as complex needs due to, and it will tell you why this client has complex needs that is showing up in PSYCKES. And then we also have prescription prior authorization as well as why a client is eligible for Health Home Plus. So we have those information available in the notification section. So some of the sections that you might be interested in could be alert section. So this information is coming in from NIMERS. So it's going to include the alert type, the number of events or positive screens, the first date, the most recent date, provider name, program name, as well as severity, diagnoses, meds, and results. So the alert section contains information on suicidality, homelessness, positive screenings, and opiate overdose. So this is the table that you will be able to see in the clinical summary. But you do have an option to drill into the specific alert type. So when you go to the right side of the clinical summary, you are able to drill into the specific information, and that is going to show you more detailed information such as the alert or incident type, the report or billing provider, date of the incident, medical classification, as well as the source. And again, you do have the option to export in a PDF format or Excel format. All right, so we have our social determinants of health section in the clinical summary as well. So this section includes social and environmental conditions that impact a wide range of health risk and outcomes. So here, as you can see, we have the name of the social determinants of health, and then all these blue hyperlinks that you see in the clinical summary, you can actually drill into them. So you can select any of these and click on it to drill in more detailed information. So in this example, we have selected other specified problems related to primary support group. So when I selected that blue hyperlink, it pulled up this detail chart where you can see the date of service, the service type, the service subtype, provider name, and then the primary, secondary, and quality flag related diagnoses. So you can see all of these detailed information when you drill into a specific SDOH. And then here we also have our quality flags. So these are all the quality flags that a client is positive for. So all these blue hyperlinks, as mentioned before, you can select on it and it will show you the description of that specific indicator. You also have the option of the definitions that you can pull up, and you can also view this quality flag information in a graph format or a table format. So whichever one that works the best for you, you do have the options to toggle between those. All right, so those are some of the sections that I wanted to mention for the full clinical summary. And another helpful trick is that when you go to the very top of the full clinical summary, you'll see these three horizontal lines that says sections. And for this one, let's say that you are looking for a specific section and you want to be able to access that information as quickly as possible. So you can just go to our sections option right here. For example, let's say I'm looking for crisis services information. I can just come down to this link right here and select it, and it's going to take me directly to that section. So I don't have to keep scrolling down to that section. So that is another helpful feature that we have in the clinical summary. So that is an example of the clinical summary and some of the information that you will be able to find in it. So let's switch gears to MyQI reports. So the MyQI report is a tool of managing quality improvement efforts. So when you log into PSYCKES, you will find two separate tabs for quality improvement measures and performance tracking measures. Again, the QI report is updated monthly, and within the report, we have the eligible population, which will be the denominator, and then the that is the clients that are served plus other parameters depending on the quality indicator specification. We will also display the number with QI flags, and that will be the numerator. I would like to make a note that each quality indicator measures have their own specifications, and these can differ from flag to flag. So it is really important to refer to our technical specifications document that can be found on our PSYCKES website. So going back to our numerator specification, these identify the clients who meet the criteria for that specific flag. We also will compare prevalence rate for a provider agency, region, and state. You can also filter the QI report by program type, client residence, or provider location, region, or county. You also have the option to drill down into a list of recipients who meet the criteria for a flag. And we, of course, have a race and ethnicity view of my QI reports, which we will take a look at in the next few minutes. And you can also export these reports to Excel and PDF. So, just a little bit more on understanding my QR reports. So, my QR report will have attributing clients based on a couple of different things. So, the first one is billing. So, clients are linked to a provider agency if they have been billed by the agency in the past 9 months. We also pull information from the MAP Health Home and Care Management Agency database. So, clients that are linked to a provider agency if they are enrolled in a health home or a CMA, according to MAP, will also be linked to QI reports. And then this rule is used to automatically link the clients to providers so that current clients are included in the report each month. The period of observation for the quality indicator does depend on which measures you're looking at. So it will vary for each of these measures. For example, we have the period of observation for high utilization quality indicator at 13 months. So that is a 13-month look back for that specific measure. So this is what the QI reports looks like in our PSYCKES application. So when you go to our top purple bar, you have the option of My QI reports, and it is divided into two separate tabs. So we have our quality improvement, and it also shows you the as of date. So the quality improvement measures are considered a more real-time data, and it is run on a monthly basis. And the next one that we have is this performance tracking measure. And as you can see, we have the as of date here as well. So the performance tracking measures are run with an intentional lag of 6+ months. So taking a look at our quality indicators QI reports page, you can see the indicator set, you have the population, we have the eligible population slash episode, so that's our denominator, number with QI flag, so that's our numerator, we have the percentage, we have the regional percentage, as well as the statewide percentage. And you can view all of these information in this graph visualization as well. So another feature that we have in our QI report screen is this filters option. So you can select a wide variety of filters to look for the information that you're interested in. So we have site filters, program type, managed care, age group, population, client residence, and provider location as well. So you can apply any of the filters that you like to view the information that you are interested in. All right, so let's take a look at some of the vital signs dashboard related measures as an example. So I am in the performance tracking tab, and from there I can see a list of indicator sets, and I'm going to see this vital signs dashboard adult and vital signs dashboard child indicator. So when I select Vital Signs dashboard from the previous screen, so from that indicator set, now it's going to show you the indicators, and it's going to show you all these measures that are associated with Vital Signs dashboard adult. And the feature that we have built in is that if you're looking for a definition of what these measures are and what calculations that they have, you can just hover over these measures and it will show you the definition. So, for example, for no follow up after mental health inpatient 7 days, when you hover over it, it will show you the definition right here. And all the other information, it's quite similar to what we saw in our indicator set slide. So we have the population, we have eligible populations last episode, number with QI flags, as well as the proportions included right here. So let's further drill into it. So we are going to drill into this no follow-up after mental health inpatient 7 days, and that is going to take me to this unduplicated recipients list. So it's going to show me clients who meet the criteria for this measure. So as you can see, we have the recipient, the Medicaid ID, the date of birth, race and ethnicity, quality flags, current PHI access, and in this example, you can see that PSYCKES consent is entered. So you can see that the client's name is going to show up in a blue hyperlink, and when you click on it, it's going to take you to the clinical summary. But if consent has not been entered, it will show you no access, and you do have the option to enable access. But when you have no access, you will not be able to further drill into the client's clinical summary. So from the screen, you can drill into the clinical summary. You can also export this information in a PDF or Excel view. All right, so when you select the standard view. So we have all these different views available, and when you select the standard view, as we saw on the previous screen, it will show you quality indicator prevalence rate for the organization compared to the region and statewide prevalence rates. But if you come down here and select the race and ethnicity view, it will display quality indicator prevalence rates for clients in different race and ethnicity groups, as you can see in this screenshot right here. So the race and ethnicity view displays the percentage and number of clients flagged for each of the quality indicators. And again, this is broken out by different race and ethnicity groups. So the Medicaid data is the source for this information. So when the race and ethnicity view is applied, it is applied both to the numerator and the denominator, and a percentage is calculated. You can see clients who identified more than one race in their Medicaid registration, and that will be represented by multiracial group, and then clients who identified as Hispanic or Latinx as their ethnicity are represented in the Hispanic or Latinx group only. And then for clients where race was unknown on their Medicaid billing, they're still included in this total category, but they would not be represented in one of these unique breakdowns. And you also have the option to export the race and ethnicity view to a PDF in Excel format, and it's going to show you the same information. And I just also wanted to point out this graph. So when you hover over these numbers, it will actually show you the exact breakdown of how these percentage were calculated. So you can hover over any of these graphs and it's going to show you additional information. So that is our race and ethnicity view that we have in our QI reports. So let's jump into our statewide reports. So we here you can select an indicator. So in this instance, we have the vital signs dashboard selected, and of course you have the option to look at the indicator definitions as well. And then we are going to select indicator type. So these are all the indicator types you can select from. And in this instance, we are going to select Vital Signs Dashboard Adult Summary. And in Statewide Report, what it does is that actually shows you a really nice map of New York State, and it provides a visual of those percentage of positive case flagged for selected quality indicator organized by county. You can also have the option for region, county, provider region, and provider county, network, provider, and plan. And again, you can compare these numbers if that's an information that you're interested in. And you also have the option to export this in PDF and Excel format as well. All right, so now let's shift gears to our vital signs dashboard. So, the Vital Signs Dashboard is a tool to visualize public mental health system performance within domains of access, quality, and treatment outcomes. And it's derived from Medicaid claims and refreshed on a monthly basis. So, right now, the VSD is showing from October 2024 to September 2025, and it includes the full Medicaid mental health population, and that individuals who received a mental health diagnosis or service in any setting. Now, we have the data in VSD available by county, region, provider, agency, or network. And then you can also filter by population, and that you could look at the full mental health population or OMH license programs or by program type. And then we have the disparity population, so that includes race, ethnicity, gender, or region. So, why is the VSD important? It is important because it really helps to identify emerging and persistent disparities, and it also helps provide input to OMH's quality strategy to improve the public mental health system. So, you can see the more data that we collect on workforce diversity, inclusion, training, mentoring, and supervision that can all be affected by VSD and can help reduce disparities. So we have a number of different quality measures showing in the VSD. So these measures are tools that help with measure outcomes that are associated with the ability to provide high quality healthcare. So right now we have 14 adult and 13 child and adolescent measures currently in the VSD. And the VSD measure selections was through relevancy. So measures that highlight disparities. We also looked at importance. So measures currently used in public mental health systems by managed care plans, by value-based payment services, or by BHCCs, etc. So we looked at the feasibility. So how we could establish measures definition familiar to the public mental health system. And then we also use the CMS and New York State QARR, and they prioritized measures for stratification by race. And of course, these measures that were selected originally can definitely evolve over time, but these are the measures that we have so far. So for VSD measures related to adults, we have the domain right here. So we have access, treatment outcome, and quality. And then we have measured names. So some examples are colorectal cancer screening, utilization of medication assisted treatment for opioid use disorders, and many more measures here. And here's another example of the VSD measures associated with child that's displayed. Again, it's divided into these domains. So we have access, treatment outcome, quality, as well as the measure names. So let's take a look at the VSD dashboard. So when you access the vital signs dashboard, you can select these different toggle options to help understand the dashboard, as well as narrow down search results and look for information that you are interested in. So right now I have the VSD home adult information selected. You can select and toggle over to the VSD home child, trends over time, data download, as well as the definitions. So when you come down here, you can also select region, county, network, or agency. Currently, I have set it to statewide, but when you select this drop down, you have all these other information available. And then from the population drop down, you can select from full mental health population, or you can choose based on OMH license programs or program types. So once you have these filters selected, it's going to show you this information that's divided into different categories or domains. So we have access right here, and these are all the measures associated with access. We have treatment outcomes, so we have 4 of those associated with it, and then we have quality domain located at the bottom. So when you hover over these numbers, so for example, we are looking at the access domain, and I'm looking at the colorectal cancer screening, and I'm seeing this for 52%. And if I want to know, well, what is this 52% representing, how's this number calculated, you can just hover over this number and it's going to show you this pop-up box that's going to show you the domain, the measure, the description, as well as the age specification, the denominator, the numerator, and when the data was collected. So when you hover over these, you can see what the measure is and how it's calculated. Now, if you scroll down that page, you can also view the measures by disparity population, such as total mental health population, the race ethnicity population, which is currently showing, and then you can also search by gender or recipient region. Now you can view this in a chart or a table. That is another option that you have available. And that's another filter option at the top right here. And here you can see on the left-hand side, the measure name, the population includes that we're looking at, the statewide average performance, the disparity category, the numerator and denominator, and the performance. And you can see it compared to statewide average, if it's lower, equal to, or higher than statewide average, as indicated by these colorful dots. And then when you hover over this dot, it will actually show you the numerator and denominator for that specific disparity category that you have selected. So in this instance, when I hover over this green one, it says 965 out of 1,678 Asian beneficiaries remain on an antidepressant medication for 12 weeks. Asian rate is lower than statewide full mental health population average rate. So when you hover over these numbers, it will show you these additional analysis that that could be helpful for you. And then when you toggle over to the chart view that we are looking right here, it actually shows you a visual of the region, county, or agency's performance compared to the statewide performance rate per measure. So either lower than a statewide, equal to, or higher than. And you can, of course, hover over these color options as well to view more information, as you can see right here. All right, so now that I've shown you the vital signs dashboard, and in the previous slides, I also showed you our PSYCKES vital signs dashboard located in our My QI Reports tab. And one thing that you may notice is that the name of these vital signs measures are slightly different. So on the left-hand side, we have the PSYCKES vital sign measure label, whereas on the right, we have the dashboard measure label. And as you can see for PSYCKES, it shows no follow-up after mental health ED visits 7 days, whereas the vital signs dashboard, it shows follow-up mental health ED 7 days. So the vital signs measures that are displayed in PSYCKES have their data flipped. So what this means is that the dashboard measures are identifying people who are meeting the measure criteria or providing the good news, whereas PSYCKES identifies people who are not meeting the measures to identify opportunities for improvement. So PSYCKES flags people with quality concerns so that individuals needing intervention or assistance can be quickly identified. So that is a little description of our vital signs dashboard, which might be beneficial for you and the work that you do. And as we are nearing the end of our webinar, we would love to hear your feedback about what new features you'd like to see in an application that would really just help all the work that you do, the workflow that you have, the types of report that you're trying to run, the data that you'd like to see. So we have a few questions. We have about 3 questions. So to participate in our poll, there should be a Slido app option that is shown at the bottom right hand corner of your WebEx screen. So we are going to launch our first question here. So for anyone who's interested in answering, we would love to know, would you like to see any enhancement added to recipient search? That enhancement could be anything that you can think of. So For examples, are there any new population filters that you would like to see in our PSYCKES application? Are there any other filters that you would like to see, any service settings that might be helpful for you to be included in the PSYCKES application? So I believe the poll that we have is open. So I will give it a couple more seconds, and the poll has been launched. So you can just answer these questions through the Slido app. Yeah, and also, I did wanted to mention that as you're answering the question, if there are additional feedback that you have that you'd like to send it to our team, feel free to send that to our help desk as well. So any features that you'd like to see, please feel free to provide detailed information, and we can certainly review it internally with our team. But I can certainly include our help desk information. So if you think of something later that you might think would be helpful to be included in the application, we can do that. You can send it through our help desk as well. But I'm going to give it a couple more seconds, and then we can close the first question and we can jump right into our next question. All right, so we can move on to our next question. All right, so thank you for answering the question. And the next question that we have here is, are there any additional data source that you'd like to see added to PSYCKES? So some examples that we have listed here is any cost-related data that would be helpful with ODA data be helpful? Are there any data sources that you would like to see us incorporate in the application that we may not already have? So I will keep this open for a couple of seconds as well. But we are in the process of adding additional data sources, so please be on the lookout for the new data sources. Of course, we will communicate that with the users, but any data sources that you'd like to see that's not included in it currently. Of course, we are certainly discussing including OTA data source in the PSYCKES application, so that is currently in discussion. Absolutely. Okay, so we are also seeing a couple of OPWDD, NYCHA housing recipients information. These are really helpful, and we will certainly discuss it internally with the team. So thank you so much for answering. And I'll keep the poll open for just a few more seconds in case if there are any other answers anybody would like to add. All right, so we'll be closing this poll question, and we can move on to our next question. Hopefully this is the last question that we have. All right, so let's go to the next one. So thank you all so much for responding to our previous question. And the last question that we have here is, would you like to see any functionality updates within the application? So for example, would you like to see more multi-select filters and recipient search? Are there any additional look back periods that you are interested in that we may not already have in the application? So any functionality updates that would be helpful for you and the work that you do that we can include in PSYCKES. So we have that poll open, so feel free to respond. And while we're answering this question, I do wanted to go to our next slide and provide you our help desk information. So if you're interested in adding specific features to PSYCKES, please feel free to reach out to us at psyches-help@omh.ny.gov, and please provide as many descriptions as possible. So we are seeing a couple of responses. So any Information more than 5 years could certainly be helpful, so we will definitely discuss it with the team. But any other functionality updates anyone is interested in? I will probably keep this question open, but there are a couple of additional information that I wanted to pass out since it discusses some of the resources. So going to our training and technical support, we have additional webinars, user guides, short how-to videos available on our public website. So feel free to navigate through these and we'll go through any trainings materials that might be helpful. And then we, of course, have our Psyche's help desk information here. So if you have any questions, please feel free to reach out. And then we also have our OMH help desk information. So if you have any issues with token, feel free to reach out to them and they will help you with your token. But as we are nearing the end of the presentation, I just wanted to ask in and see if there were any questions in the Q&A box that we can address on air.
Hi, Ashma. It looks like we have one question. They would like to know if they can filter the statewide report so it only shows individuals served by their CCO.
That is a great question. And I think for that one, you can definitely filter by program type. And that should show a bunch of different filters options that we have listed in the drop down. But there's also once you select the filter, you have the options to toggle between client region, county, as well as provider. So that's another option where you can filter for the information that you're looking for. If you're looking for something very specific, we encourage you to reach out to your help desk and we can certainly provide you a step-by-step process on how to get that information. But thank you so much for writing in. I know that we are right in time, but I just wanted to quickly check in and see if there were any other questions that we can answer.
It looks like that's the only question we have right now.
All right, thank you so much. And thank you so much, everyone, for attending this webinar. We really hope that this was helpful. And again, if you have any questions, please do not hesitate to reach out. I hope you all have a wonderful rest of your day. Thank you, everyone.